Hi everyone, this is Anna Dolopo and I am a fertility specialist here at Elements in Harmony Acupuncture and Chinese Herbs in Laguna Hills, Orange County. I also specialize in pain. My actual specialty is pain, but things happened over the last few years, and next you know, I am treating and making a lot of babies. These are a few of my babies since 1999. This, as of yesterday, started my 24th year in practice. We have also two amazing new doctors here. They're not new, but they're new here, Dr. Shore Omedi and also Dr. Hope Lin. So we're all here to help you either with pain or mental health issues or fertility. Fertility is something that I've really come to embrace, and I've done well over 60 fertility videos, so I'll let the other videos speak for the other subjects. Today we're going to talk about motility of the sperm, and this is so important because one of my fertility clients, a man who's gung-ho about, very motivated to have babies, I'll leave his wife's health issues out of it, but I'll just talk about his sperm motility. His doctor did not think, a specialist, did not think that acupuncture and supplements and herbs could help him. She said, you can try it, but you're going to have to go the Western medical route. Well, when they first checked his semen analysis, it was a 6 and it went down to a 3. We started working together and he called me last week. He was so excited to find out that a sperm motility analysis was a 42%. So I'm going to share some information that I found on Google and also on Yahoo. You can find them also. These were the top ones that pulled up. But before I do that, I'm going to share with you the number of treatments. So he did, today is June 23, 2022. He started on March 7, 2022. In March, he received 6 treatments, April, 7 treatments, May, 4 treatments, and in June, 3 treatments before he left the country. He's on vacation. So just to give you the dates, in March, he did March 7, 11, 21, 24, 28, 31. So he kind of spread them out, but they were 6. And then April, he did 7, April 4, 8, 12, 14, 21, 25, 28. And then in May, kind of busy. He's a very busy man at work. He did 4 treatments, May 5, 17, 25, 26. And in June, he did June 1, 10, 14. And he was very aggressive with some supplements and also the Chinese herbs. And you see what he's done with the acupuncture. The specialist who told him that his sperm motility was not going to change, the reason why my particular client did not believe him is because his brother went through the same thing. And his brother was able to get tremendous results. And he also has children. So that is the telltale of what results are. Not just the lab test, but the fact that he actually has healthy, happy children. So let me just read to you from, I think, 5 websites. The first one is verywellfamily.com. Second one is invitra.com, healthline.com, healthcare.utah.edu, medicalnewstoday.com, and fertilitysa.com. That's low sperm motility, San Antonio, Texas. So these, when I was looking these up on Yahoo, it showed 770 million search results. I checked on Yahoo and Google just to see what were the top searches, and I'll share with you the importance of motility. So what I did first was give you the results. Now I'm going to share with you the data of why motility is so important. The first one is from verywellfamily.com/sperm-1960141. When sperm motility in a single ejaculate is 50% or more, this is seen to be normal. Even a lower motility between 25 and 50% may not lead to issues. However, when the motility is consistently under 25%, the risk of motility problems are much greater. So you can see just from that link how the reason why 3% was not good. The second website is invitra.com/en- hyphen or /analysis of sperm motility. It is analyzed through a semen analysis report and is considered to be altered when the number of progressively motile spermatozoa is less than 32%, or the total number of motile spermatozoa in the ejaculate is less than 40%. So you can see why he's happy to be at the 42%. He's still on my herbs. He significantly cut down on the supplements because they were just way too much. They were supplements that he put himself on. He really feels like the herbs as well as the acupuncture have been great. I'm glad he did those supplements, but they were just, there is such a thing as maybe too much. So I like less is more. I'm very grateful that he's finally doing the herbs, and he's been getting results. So, you know, I'm grateful that he's focusing on herbs and acupuncture, and I'm very certain that it's going to go up even more. All staying in the perfect range. So this one is healthline.com/health/fertility/sperm-motility #diagnosis. Sperm motility can be tested through routine semen analysis. For the test, you'll need to provide at least 2 semen samples. These are usually obtained by masturbation at a doctor's office or testing facility. It's also possible to obtain a sperm sample by having sex with a condom or withdrawing to obtain the sample. The sample must be kept at room temperature and delivered to the facility within 30 to 60 minutes. If less than 40% of your sperm are motile, you're considered to have low sperm motility. So again, another one sharing that it's got to be above 40%. The first website said ideally it should be over 50%. However, when the motility is between 25 to 50%, it may not lead to issues. So now that I've read that in the first one, my intention is definitely to get his sperm at above 50%. So the next one is from healthcare.utah.edu/fertility/treatments/diagnostic-semen-analysis.php. So it just basically showed standard test. Volume should be normal, would be 2.0 milliliters or greater. Sperm count should be 40 million or more. Sperm concentration should be 20 million or more per milliliter. Total motility should be 40% or more. So I'm not talking about morphology or mobility in this. When I'm working with clients, fertility, if you're over 35, you got to be here. Daddy has to be here at least once a week. I have it on my website showing from the national, from PubMed, the Mayo Clinic. We need to understand that a third of the issue is mommy, a third of the issue is daddy, and a third of the issue of fertility issues are both. So if you're over 35, I've kept saying in my over, 50 plus, if not 60 or more fertility videos now, daddy needs to be here. Daddy definitely needs to be here. If you really want to have a baby, daddy needs to be here at least once a month. You see these numbers: March 6 times, April 7 times, May 4 times, June 3 times before he left the country. So results make momentum happen even more. He really wants this baby. I am so happy because usually it's mommies that come here. And if you watch my other videos, I'm always saying, why am I treating only the mommy? When daddy, I need this. And if you come to my Qigong's for everyone. It's especially if you want to relax. But if you're a fertility client, you need to be at my Qigong classes. I teach at the beach 1 or 2 times a month. And you need to be doing Qigong every day. Minimum 5 minutes a day. And if you are good with 5 minutes, that's okay. You're putting in the bare minimum to have a baby. If you want to have a baby, don't do the bare minimum. And I did a video called Sperm. And if you go to Elements in Harmony, I'm not done with the citing, by the way. But if you, let me see, there's one on sperm. If you go to Elements in Harmony, acupuncture.com/sperm, you'll see that very important video regarding the requirement that mommies and daddies should not abstain from sex for more than 2 days, because the quality of sperm goes down after 2 days. You should be having sex more than 2 days. And one thing that I say here in my practices: have sex to have fun, not to get it done. Have sex to have fun, not to get it done. Your libido is very important to me. Fertility clients, you should be texting me every day because you have assignments, and it's 5 minutes a day will change your life forever. You should be doing Qigong way more than 5 minutes a day. But if that's all you can do, that's fine. If you've been working with me for over 6 months or a year, you might want to stop doing the bare minimum, and you might want to really be in my happy club, really be in my Qigong classes, really be texting me every day, really be visiting the private pages, and more. And daddy needs to be here. This is evidence why daddy needs to be here. If your husband is 35 and over, and I know what that's like because we had our second kid at 36 and our third kid at 43, natural conception. What do you think my husband's sperm morphology, mobility, motility were like? And he takes supplements. And, we weren't trying to have a baby at 43 years old. And when we were, quote unquote, trying, I hate that word, but when we were trying, when we were focused on having our second baby at 36, we had a baby in 3 months. When I asked you to text me, it's for a reason. So we're going to stick to the motility. One more, actually two more, medicalnewstoday.com/articles/320160 hashtag what dash is dash sperm dash motility. So poor sperm motility or asthenozoospermia is diagnosed when less than 32% of the sperm are able to move efficiently. And then the last one is, I found it on, the name of the page is Low Sperm Motility from San Antonio, Texas. The website is fertility.com/blog/low-sperm-motility-causes-and-treatments. So they're obviously a fertility specialist in San Antonio, Texas. IUI, intrauterine insemination, a form of artificial insemination. This procedure involves placing the sperm into the woman's uterus, significantly reducing the amount of swimming necessary for it to reach the egg. Doctors usually begin this course of treatment if the sperm has motility of at least 30 to 35%. So, what did we learn? We needed at least 40%. Now that I've read the first website, it's got to be 50%, but between 25 to 50%, it's okay. I think that's what I read. But I'm grateful that in 20 treatments, we got it from 3 to 42. That you can see how motivated he is. And please do visit my website, elementsinharmonyacupuncture.com. You'll see that there's a section just on fertility, pregnancy, and birth. So it is elementsinharmonyacupuncture.com/fertility-pregnancy-birth. I have other fertility newsletters. I'll give them to you here. By the way, if you want to check out my newsletters, go to elementsinharmonyacupuncture.com, and you can see that where are my newsletters? /newsletters, and I have posted a lot. I've archived the newsletters there. So specifically regarding fertility, since you're here, there's a Path to Baby newsletter 2022 that I did. It's elementsinharmonyacupuncture.com/path-to-baby. And then another newsletter is elementsinharmonyacupuncture.com/babies. Another one is You Can Still Be a Mommy newsletter. You'll find that under newsletters. There's a pregnancy newsletter. Once you find out you're pregnant, don't just stop what you're doing. Go to elementsinharmonyacupuncture.com/pregnancy-newsletter. I treat all kinds of pregnancy issues, from just normal, low risk to high risk pregnancies. And then please do visit my website where I did a video called Making a Baby Takes Commitment newsletter. This woman had 4 failed IVFs, a couple of failed IUIs, and 2 miscarriages from natural conception. And then we started working together, and she's 40 and she's 22 plus weeks pregnant. This is the longest she's ever been pregnant. Strong baby, strong heartbeat. So I hope you got a lot of information from this website. From this video. I'm really excited to work with you. This is evidence that daddy needs to be here. The issue is not just a woman. I keep saying this. This issue is not just a woman. That is, like, my husband's in IT, and he says this frequently. Why do these men and women think that it's so archaic? Those are the words he used. Isn't it archaic that couples think the woman is the one with the health issues? So when I found that study on PubMed, and on Mayo Clinic, and I put it on my website showing a third of the issue was the man, a third of the issue of the woman when it comes to infertility, and the third of the issue was both. So here's the deal, you guys. If you're 35 and over, don't kid yourself to think it's just the woman. And someone just texted me today, someone I used to, I've rescued many dogs, but someone I used to show Staffords with for 8 years. She texted me out of the blue. She lives in the Bay Area, and she said, hey, do you think acupuncture can help with male infertility? Because the whole time they thought it was the woman. But then they realized through semen analysis that it's the man. And she said, you were the first one I thought about. So here's the thing, you guys. Don't kid yourself to think that it's just the woman. It's both. And you don't have to go very far. You don't have to go very far to find. So when I found that study, like, oh my God, this is gold. This is exactly what I've been looking for, to prove to everyone that stop pinning the issue of fertility on fertility issues on women. So I need the sperm more than I need the egg. And I share this in the Qigong, in my Qigong classes at the beach. So join me for Qigong, whether you want to get pregnant or not. But obviously this is a fertility video. So if you're watching, join me for Qigong. You got to do it every day. Stop doing the bare minimum. I'm very focused on a particular goal right now, and I'm not doing anything else but focusing on that goal. And guess what? Stuff is happening. So for you, if you want to have a baby so badly, what should you be focusing on? That. And if you're in my presence, I'm going to make sure you focus on that you just focus on that. Because if you want this picture, that's why my camera's facing this way. I have more babies than this since 1999. These days they're just coming in as digital. But if you want this picture and you want to be able to say I had my babies at 30, 36, and 43 years old, you got to get on it. You got to have great libido. You have to have perfect periods. Your sperm has to be perfect. Morphology, motility, mobility. So check me out. You can text me at 619-341-4341. You can call the office. The office number actually goes to my cell phone at 949-305-1703. Dr. Hope Lynn now works with me, and Dr. Shore Omedi also work with me. I hand selected them. They're awesome. They're amazing. They're compassionate. They love their work. And all three of us can bring to you the healthcare needs, the wellness goals that you have. All right. We look forward to seeing you. Take care. Bye-bye.